primary survey you find the casualty is unresponsive and not breathing normally, you will need to call for help. Ask a helper to call 999 or 112 and send for a defibrillator, AED, whilst you begin CPR immediately. If you make the call, stay with the casualty if possible and activate the speaker function on your phone to help communication. If you are on your own and the AED is not nearby, don't leave the casualty, start CPR. Kneel at the side of the casualty and give chest compressions. Place the heel of one hand in the centre of the chest. Place your other hand on top and interlock your fingers. Keep your arms straight and position yourself vertically above the casualty's chest. Press down on the breastbone to a depth of 5 to 6 centimetres. Then release all the pressure without losing contact between your hands and the chest. Release pressure to allow the chest to rise. Avoid applying pressure over the ribs, the bottom end of the breastbone or the upper abdomen. Perform 30 chest compressions at a rate of 100 to 120 per minute. It's about 2 per second. Once you have completed 30 chest compressions, you need to give rescue breaths. Open the airway by tilting the head back with one hand on their head and 2 fingers under their chin. Head tilt, chin lift. Pinch the soft part of the nose closed. Allow the mouth to open but maintain chin lift. Take a normal breath and seal your lips around the casualty's mouth. Blow steadily into the mouth while watching for the chest to rise, taking around 1 second as in normal breathing. This is a rescue breath. Keeping the airway open, take your mouth away from the casualty and watch for the chest to fall as air comes out. Take another normal breath and repeat the sequence, completing 2 rescue breaths. Return your hands without delay to the centre of the casualty's chest and give another 30 chest compressions. Continue with chest compressions and rescue breaths at a ratio of 30 compressions to 2 breaths until help arrives. If you have someone with you able to perform CPR, then swap over with them every 2 minutes with minimal disruption to chest compressions. Do not interrupt CPR unless a health professional tells you to stop, you become exhausted, or the casualty is definitely waking up, moving, opening their eyes and breathing normally. If this should happen, place the casualty into the recovery position. If a defibrillator, AED, arrives, ask them to turn it on and follow the instructions while you continue with CPR. So, to recap, if you come across a casualty who is unresponsive and not breathing normally, call for help, asking them to call 999 or 112 and bring an AED. If you are on your own, make the call yourself on speakerphone so you may begin CPR. Give 30 chest compressions, give 2 rescue breaths. Continue to give 30 chest compressions to 2 rescue breaths until help arrives or the casualty becomes responsive. If an AED is available, continue CPR whilst following the AED instructions. And that is how we perform CPR.